Unveiling the Hidden, Exploring Acute Pancreatitis with Cysts in Pancreas. General warning. This video contains information about acute pancreatitis with cysts, a medical condition that can be serious and require proper medical attention. The content is intended to educate and inform viewer about the topic, but it is not a substitute for professional medical advice. If you suspect you or someone you know may have acute pancreatitis with cysts, please consult a qualified healthcare provider for an accurate diagnosis and appropriate treatment. Do not attempt to self-diagnose or self-treat based on the information provided in this video. Always prioritize your health and well-being by seeking guidance from a medical professional. Disclaimer: the information provided in this video is intended for general informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. Reliance on any information provided in this video is solely at your own risk. Hello, welcome back to our channel. Today, we are going to discuss a serious medical condition that affects the pancreas and liver, acute pancreatitis with cysts. In this video, we will explore the types of acute pancreatic diseases, the detailed symptoms, possible causes, treatment options, and even touch upon Ayurveda remedies and dietary recommendations. Acute pancreatitis is a condition characterized by inflammation of the pancreas. The pancreas is both an exocrine gland producing digestive enzymes, and an endocrine gland secreting hormones that regulate blood sugar levels. Pancreatitis can be acute or chronic. Acute pancreatitis develops quickly and lasts for a short time. Most people recover fully with no permanent damage, but severe cases can be life-threatening. Chronic pancreatitis is a long-term, progressive condition that leads to gradual but irreversible damage of the pancreatic tissue, eventually resulting in loss of pancreatic functions. Patients with chronic disease may also have acute attacks. Acute pancreatitis is typically initiated by premature activation of pancreatic digestive enzymes, which normally activate only when they arrive in the intestine. Active digestive enzymes can cause autodigestion of the pancreatic tissue and trigger inflammatory response, which may spread to other organs. Locally, this can cause edema, damage to abdominal organs, and formation of pseudocysts, which, if become infected, can be life-threatening. Once inflammation becomes systemic, multi-organ failure, with high morbidity and mortality, may result. Repeated acute attacks can also develop into chronic disease. Types of acute pancreatic diseases. The two primary types of acute pancreatic diseases associated with cysts in the pancreatic region and the liver are acute pancreatic pseudocyst and polycystic liver disease. Acute pancreatic pseudocyst refers to the collection of fluid, pancreatic enzymes, and tissue debris around the pancreas, usually resulting from acute pancreatitis. Polycystic liver disease, on the other hand, is a genetic disorder characterized by the development of multiple cysts in the liver. The symptoms of acute pancreatitis with cysts may vary depending on the severity of the condition. Common symptoms include severe abdominal pain that radiates to the back, nausea, vomiting, bloating, jaundice, and weight loss. The causes of acute pancreatitis can include gallstones, alcohol abuse, high levels of triglycerides, certain medications, infections, trauma, or genetic factors. The leading cause of acute pancreatitis is ductal hypertension, when the pancreatic duct is obstructed by a gallstone, forcing digestive enzymes and proenzymes to back up and accumulate in the pancreas. Many toxins can stimulate early activation of proenzymes, or zymogens. These changes include increased production of zymogens, weakening of zymogen granules, and increased intracellular calcium concentration. Some people may also be genetically predisposed to pancreatitis. They have mutations in genes involved in activation of trypsin, or mutations that make them more prone to ductal obstruction. Chronic disease can eventually lead to loss of pancreatic functions, which manifests as malabsorption, malnutrition, diabetes type 1, and hypoglycemia. The risk for pancreatic cancer is also increased. The most prominent symptom is a moderate to severe upper abdominal pain that may radiate to the back. The pain is typically alleviated with sitting up or leaning forward, and worsens with lying flat, coughing, deep breathing and exercising. Pain from acute pancreatitis tends to be more severe and constant. It develops abruptly in gallstone pancreatitis, and gradually over a couple of days in alcoholic pancreatitis. Patients with chronic disease may initially experience pain episodically, typically after meals, but as the disease progresses, the pain can become constant. Other symptoms of acute pancreatitis may include nausea, vomiting, rapid heart rates, and rapid shallow breathing. Blood pressure and body temperature may fluctuate high and low. Severe cases may present with signs of other organ failure. Other symptoms are more subtle in chronic patients, with signs of pancreatic insufficiency develop slowly over time. These include indigestion, abdominal distension and oily stool, loss of appetite, unintended weight loss, and fatigue. Diagnosis: acute pancreatitis is diagnosed based on the pain pattern, blood tests for elevated pancreatic enzymes, and imaging studies to detect swelling, fluid accumulation, gallstones, necrosis, and pseudocysts. For chronic patients, pancreatic function tests are performed to measure serum trypsinogen, fecal chymotrypsin, elastase, and fecal fat in patients with a high-fat diet. Pancreatic calcification can be detected with X-ray, CT scan, or MRI of the abdomen. Details of treatment and medicines. The treatment for acute pancreatitis with cysts may involve a combination of medical interventions and surgical procedures. Initially, the medical team will focus on pain management, intravenous fluids, and nutritional support. Pain relief is achieved through analgesics, while anti-inflammatory drugs like ibuprofen help reduce inflammation. Enzyme replacement therapy might be prescribed to aid digestion. In severe cases or if complications arise, the doctor may recommend surgical procedures, such as cyst drainage or removal. Antibiotics may also be prescribed if there is evidence of infection. Adopting a healthier lifestyle is essential. Abstaining from alcohol, maintaining a healthy weight, and managing cholesterol levels can mitigate symptoms and prevent flare-ups. Alongside medical treatment, dietary changes are crucial for managing acute pancreatitis with cysts. Dietary recommendations and avoidances. To alleviate symptoms and support the healing process, it's important to avoid foods that can trigger inflammation or worsen pancreas and liver function. Vitamins A, D, A, and K are most commonly found to be lacking as a result of chronic pancreatitis. Alongside medical treatment, dietary changes are crucial for managing acute pancreatitis with cysts. Eat 5 to 6 small meals throughout the day to help recover from pancreatitis. This may be easier on your digestive system than eating several large meals. With acute pancreatitis, you may want to avoid eating too much fiber at once. To allow your digestive system time to heal, you may want to start with soft, starchy carbs like potatoes and pasta before reintroducing high-fiber whole grains. Some people with chronic pancreatitis may need to avoid a high-fiber diet. With this condition, large amounts of dietary fiber may make your digestive enzymes less effective. Do's and don'ts. Eat food items in acute pancreatitis diet plan. Do's: best foods to eat in acute pancreatitis. Eat a high-protein, low-fat diet with no more than 30 grams of fat per day. Whole grains and cereals should be consumed as they work to protect your digestion and fight the free radicals that damage your pancreas. Low-fat yogurt should be an important part of your daily diet, whether you have it with your meals or as a light snack. Four, veggie soups are great as well. Spinach is rich in iron, so consume loads of this veggie. Blueberries are great as they are rich in antioxidants that combat free radicals. 5. Vitamin B is important, so keep foods such as dark leafy veggies, whole grains, etc. in stock. 6. Fluids are a must. Increase intake of water, juices, herbal teas, clear broths and soups. 7. Eat smaller meals and more often. Point 8. Lose weight, if you are overweight. Don't eat if you have pancreatitis. Dietary restriction 1. Red meat, pork, lamb and duck. Point 2. Dairy foods such as all cheeses, margarine, butter, cream, ghee, full-fat dairy, mayonnaise, regular milk and ice cream. Point 3. Avoid tea, coffee, and packaged drinks. Point 4. Fried foods, pizzas, eggs, potato chips and beans should be avoided at all costs. 5. All nuts and nut butters. Point 6. The above-mentioned foods are rich of simple carbs and fat which put pressure on pancreas for the secretion of pancreatic juices which may cause severe abdominal pain and may worsen the condition. Point 7. Quit smoking or chewing tobacco. Point 8. Do not drink alcohol. Foods to eat and foods to avoid. Food group, suitable low-fat options and high-fat options to avoid. Ayurveda offers a holistic approach to managing health conditions, including acute pancreatitis. Certain Ayurvedic herbs and formulations, such as triphala, aloe vera juice, and turmeric, may possess anti-inflammatory and digestive properties. However, it's important to consult with an Ayurvedic practitioner or healthcare professional before incorporating any Ayurvedic medicines into your treatment plan. Yogasana to enhance pancreatic functions. When carried out in precision, the yoga postures tone and massage the pancreas and liver as well as the neurological and circulatory systems to relieve stress, maintain a balanced weight and regulate blood pressure. Vajrasana, thunderbolt pose. Crouch on your knees with your feet kept side by side to each other. Sit on your heels with your backbone and neck aligned. With palms down, relax your hands on your thighs. Now fix your gaze straight ahead and sit in that position for at least 30 seconds while taking long deep breaths. Relax and repeat it 4 more times. Benefits: the thunderbolt pose is the only pose that can be performed right after lunch as it helps in the complete digestion of food. By boosting blood flow to the stomach, intestine and pancreas, it stimulates the pancreas to secrete digestive juices that facilitate the breakdown of food and helps keep gastrointestinal aberrations at bay. Viparita Karani, legs up the wall pose. Start the asana by sitting about 3 inches from a wall. Lie down and raise your legs upwards while resting the thigh against the wall. Keep your arms on either side of the body and just lie down for 5 minutes or as long as you want to and then slowly pull your leg back to the starting position. Benefits: Viparita Karani inverted posture tones the abdominal organs, facilitates proper lymphatic drainage, evens out blood circulation, which eventually helps in preventing sugar spikes and digestive woes. It also releases trapped pressure from the back and hip and prevents any pain or inflammation. Ardha Matsyendrasana, sitting half spinal twist. Sit straight on the floor with your legs stretched out and feet together. Bend your left leg and place the heel of your left foot beside your right hip. Take the left leg over the left knee. Put your left arm on your right leg and your right arm behind you. Slightly twist the waist, shoulders, and neck towards the right side and look over the right shoulder. Try to be in this posture for a minute and slowly return to the initial position and repeat in the same manner on the other side. Benefits: the spinal twisting pose is highly crucial in strengthening and toning the abdominal organs and muscles, which eventually helps in lowering blood sugar, stimulating digestion and providing relief from breathing difficulties, stress, and tension. Practicing this asana routinely bolsters the immune system and helps in eliminating ama doshas from the body. Paschimottanasana, seated forward bent pose. Start the posture by sitting straight and extending your legs forward. Keep your spine erect, bend your hips and straighten your arms forward and rest your upper body on your lower body. Drop your arms loose and place your palms wherever you can reach them. Try to place your nose on your knees. Be in this posture for 20 seconds, take a minute break and repeat 5 times. Benefit: the seated forward bent pose is particularly beneficial for stimulating the lungs, kidney, pancreas and liver. Additionally, it works towards relieving gas, while also cooling the body and calming the mind. Finish the yoga session by relaxing for a minute in the Shvasana. Let's dive into a real-life case study to understand how acute pancreatitis with cysts can be successfully managed. Case Study 1. Successful treatment of acute pancreatitis with cysts. Host: meet Emily, a 35-year-old woman diagnosed with acute pancreatitis with cysts in the pancreatic region and the liver. Through a multidisciplinary approach involving pain management, intravenous fluids, nutritional support, and a surgical procedure to drain the pseudocysts, Emily experienced significant relief from her symptoms. She diligently followed her doctor's instructions, adhered to a specialized diet, and received regular checkups to monitor her progress. 2. John, a 42-year-old man diagnosed with acute pancreatitis with cysts, took a comprehensive approach to his treatment. Alongside medical interventions and surgical procedures to remove the large cysts, John incorporated Ayurveda remedies, dietary modifications, and stress management techniques into his daily routine. This holistic approach helped him alleviate pain, improve digestion, and enhance overall well-being. Facts about acute pancreatitis with cysts. 1. Can acute pancreatitis with cysts be prevented? While some risk factors are unavoidable, adopting a healthy lifestyle can reduce the risk. 2. Are there any long-term complications? Chronic pancreatitis, diabetes, and pancreatic insufficiency can result from recurring episodes. 3. Is surgery always necessary? Surgery is considered when complications arise or conservative treatments fail. 4. Can diet alone cure this condition? While diet plays a significant role, it's best complemented with medical management. 5. Is genetic testing recommended? If there's a family history of pancreatitis, genetic testing can provide valuable insights. Conclusion: acute pancreatitis with cysts is a complex condition that requires careful management. If you or someone you know is dealing with this condition, it's important to seek medical advice promptly. Remember, treatment plans should be personalized and supervised by healthcare professionals. If you are health conscious, don't forget to like, comment and subscribe to our channel for more informative videos. If you want to know about liver cirrhosis with PVT and hypertension, please click below video link, https://youtube.be/oz__arcasa. Thank you for your support. Hope you have become more aware and knowledgeable about acute pancreatitis with cysts. If you want to know about liver cirrhosis with PVT and hypertension, please click below video link, https://youtube.be/oz__arcasa. Thank you for your support.